Putri.
Assalamualaikum warahmatullahi wabarakatuh. And thank you to our instructor, Assistant Professor Dr. Muhammad Yusof. Today, our group 7 will present our first PBL toxicology, which is about recreational drugs. My name is Najah binti Kamaluddin, and my group members are Nadia, Madiha, Anis, and Akilah. Next. Let's move on to the PBL triggers. First PBL, there's about 23-year-old male went to the emergency after complaining of palpitations, chest tightness, dizziness, and headache. He actually illegally joined a party when claimed he ate but taken no drugs. He vomited more than once and feels very hungry. And second PBL, he confessed to inhale something at the party. This is the result of his clinical examination. He looks pale, agitated, and very anxious. The lungs are clear to auscultation. Heart rate is tachycardic without murmur, while the abdomen is soft and non-tender. Neurology examination showed GCS 15 with intact cranial nerves. Next. So, what are recreational drugs? Recreational drugs are chemical substances taken for enjoyment or leisure purpose rather than for medical reasons. Recreational drugs also can be defined as legal and illegal drugs that are used without medical supervision. Whether you smoke marijuana, drink alcohol, or snort cocaine, there are risks involved with using drugs that can range from addiction to death. Knowing the risks can help you make better decisions that positively affect your health. I pass to the next presenter.
Okay, I'm Nik Asma Madiha, and I'm going to talk about the most commonly abused drug there is. First, we have the cocaine, which is described as a powerfully addictive stimulant drug that is made from the leaves of the coca plant. It comes in the form of white powder or whitish crystal-like rock, and it is often snorted, smoked, or injected in the body. Okay, can we see the picture of the cocaine? So this cocaine is what I believe that we often saw in the news when police sees the drug cartels. So next we have the heroin. Heroin is an opioid type of drug that is made from morphine, which is a natural substance that is extracted from the poppy plant. It comes in the white or brownish substance, and like cocaine, it is often injected, smoked, or snorted. Okay. Next, we have the inhalants. Inhalants are common items such as household product like spray paint, marker, and glues. It is often inhaled through the nose or mouth, and it causes serious organ damage that is caused from lack of oxygen. And lack of oxygen can then lead to problem like with the thinking, movement, vision, and hearing of the drug abusers. And next, also we have lysergic acid diethylamide or LSD. It is a hallucinogen type of drug that is manufactured from lysergic acid, which is found in ergot. Ergot is actually a type of fungus that grows on rice or grains in general, and it comes in the form of tablet, capsule, and also it comes in the form of small decorated squares of absorbent paper, which I'm going to show you on the picture below. Okay, so the small decorated papers are then stick onto the body, and then the LSD will be absorbed into the abusers onto that part of the body. So next slide. Okay, then we have the MDMA, which is the ecstasy or Molly. It is a synthetic psychoactive drugs that have similarities to both of the stimulant named amphetamine and the hallucinogen mescaline. It comes in the form of colorful tablets with imprinted logos, capsules, powder, and also in liquid form. So looking at the picture, I think it once viral in WhatsApp group about this drug, especially among the school students. Next, we have the tobacco. Tobacco comes from a plant that is grown for its leaf, which are dry and fermented before use. And it can be found in cigarettes, cigar, bidis, hookahs, or what we know as shisha. And it also comes in the form of smokeless tobacco, and it can cause irritability, many side effects such as irritability, attention and sleep problem, and also increased appetite. So this tobacco is what we suspected to be inhaled by the male in our PBL trigger, as the side effect is the most related to his signs and symptoms. And lastly, last but not least, we have alcohol, or specifically ethyl alcohol or ethanol, which is an intoxicating ingredient that can be found in beer, wine, and liquor. It is produced by the fermentation of yeast, sugar, and starches. It can be ingested by drinking, and it can cause many side effects that will be talked in detail by our group members later. Okay, moving on to the next presenter.
Thank you, Nik Asma Madiha. I am Nur Anis Amira, and I will be talking about on how does the drugs work. Okay, first, we have cocaine. Cocaine acts by binding to the dopamine transporter, blocking the removal of dopamine from the synapse, and then dopamine will accumulate in the synapse to produce an amplified signal to the receiving neurons. Second one, we have heroin. Heroin binds to and activates receptors in the brain called mu-opioid receptors. Our body contains chemicals called neurotransmitter. It will bind to the receptors throughout the brain and body to regulate pain, hormone release, and feelings of well-being. When mu-opioid receptors are activated, they stimulate the release of neurotransmitter dopamine, causing a reinforcement of drug-taking behavior. The third one are inhalants. Inhalants are nervous system depressants, which means they slow down the workings of the brain. When inhaled, the fumes enter the bloodstream very quickly, and the effects are felt after just a few seconds. The effects of inhalants mimic another depressant, which is alcohol, but it is much quicker because the chemicals are sent straight to the blood through the lungs. Next slide. Next is MDMA. MDMA increases the levels of three neurotransmitters within the synapse by enhancing their release from nerve endings and inhibiting their reuptake. Increasing dopamine produces increased energy, and it will act in the reward system to reinforce behavior. Next, increasing norepinephrine will increase the heart rate and blood pressure, which are a bit risky for people with heart and blood vessel problems. Last one, increasing serotonin will affect mood, appetite, sleep, and other functions. Move on to next drugs, which is tobacco. Tobacco is a product that contains nicotine, which can lead to addiction. That is nicotine that contained in tobacco is readily absorbed into the blood when a person uses it. Upon entering the blood, it stimulates the adrenal glands to release the hormone epinephrine, which then will stimulate the central nervous system and increase blood pressure, breathing, and heart rate. Last but not least is alcohol. Alcohol is a drug that is absorbed into the bloodstream from the stomach and the small intestine. It is broken down by the liver and then eliminated from the body. The alcohol continues to circulate in the bloodstream until the liver has enough time to break down all the alcohol. Thus, it will affect all of the body's organs, including the brain. Once alcohol reaches the brain, the person begins to feel drunk. What is common to all individuals and all situations that alcohol depresses the brain and slows down major functions such as breathing, heart rate, and thinking. That's all from me. I'll pass to the next presenter.
Okay, Bismillah. My name is Nur Akila Binti Ismail, and I will talk about the effects of recreational drugs on the health. So the effects will vary depending on which type of recreational drugs are taken by a person. Firstly, drugs of stimulants will stimulate the central nervous system, in which they will speed up the messaging to and from the brain, which makes the person feel more alert and confident. This can cause the increase in the heartbeat, the blood pressure, as well as the body temperature. So as stated in the slide, the examples of stimulants are cocaine, and as previously mentioned, can be taken by sniffing up the nose or smoking through a pipe. Ecstasy or MDMA, which is usually swallowed as a pill, and tobacco, or also known as nicotine, which can be taken through smoking of cigarettes or hookah, or it can also be chewed. So in large amount, these stimulants may lead to depression and also anxiety. And additionally, tobacco may cause increased flow of blood to the heart and narrowing of the arteries, and it may also contribute to the hardening of the arterial walls, which then may lead to the heart attack. Next, for the drug of depressants, such as stated in the slide, are heroin and alcohol. So they depress the central nervous system, and in other words, they act oppositely from stimulants. So heroin is usually dissolved into liquid, or it can also be smoked. In small quantities, a person may feel calm and relaxed. However, in large amounts, they may cause vomiting, unconsciousness, and even death. Depressants also affects a person's concentration and coordination. So taking excessive amount of alcohol may lead to poor coordination, poor concentration, and loss of coordination. As I may add, the long-term effect of alcohol addiction may also cause the kidney and liver problems, in which a person might experience acute kidney failure, as well as the inflammation of the liver. Lastly, drugs of hallucinogens may distort the sense of reality of a person. He or she may feel calm and relaxed, but also at the same time, he may experience hallucination, in which he might hear or see things that are not really there. Also, a person may experience a flashback of bad memory, in which he will feel that he is re-experiencing the bad memory again. So this may cause him to feel frightened and panic. So the example given here is LSD, or lysergic acid diethylamide. That's all for me. I pass to next present.
Thank you, Sister Akila. I am Nur Nadia binti Muhammad Fatihi, and now I will explain about the neurological examination. So neurological examinations consist of Glasgow coma scales and cranial nerve examinations. You must be wondering why these tests are needed, right? So as have been mentioned by the previous presenter, recreational drugs have various bad effects, and the chronic abuse of it or the overdose can damage the nerve fibers and brain cells, leading to irreversible side effects such as coma and death. That is why people who involve in recreational drugs must go through these examinations. So the first one is Glasgow Coma Scale. So this test is done by measuring three aspects of behavior, that is motor responsiveness, verbal performance, and eye opening. And the added score from these three assessments will indicate the level of consciousness, where the highest possible score of 15 would mean that the person is fully conscious, while the lowest possible score of 3 would indicate that the person may be in coma or dead. As for cranial nerve examinations, the health professional will assess the 12 cranial nerve and identify if there are any abnormalities in each cranial nerve from the optic nerve through the hypoglossal nerve. Next slide. Okay, so based on the symptoms described by the man in the procedure and all the examination done on him, we came up with the answer that he may inhale shisha, or also known as hookah. Hookah is commonly used in parties for enjoyment purposes, as it induces mind-altering effects that give feeling of extreme happiness or euphoria to the person who uses it. Next slide. And Okay, so last but not least, many studies have proven that intoxicants cause many harmful effects to humans. And as Muslim, we should not involve ourselves in these harmful substances as it is also prohibited in our religion. Allah has mentioned it in Surah Al-Ma'idah verse 19 that said, O you who have believed, indeed intoxicant, gambling, sacrificing on, stone altar to other than Allah, and divining arrows are but defilement from the word of Satan. So avoid it that you may be successful. I end the presentations here. Thank you for listening.